We are live with Dr. Cheryl Eberting, the CEO and founder of, how do I say the name of the company?
AZOVA.
AZOVA.
Yeah.
Tell us what AZOVA is.
Sure. AZOVA is a digital health platform. We essentially build digital provider networks and connect physicians, hospitals, laboratories, pharmacies to patients online, and essentially enable any stakeholder in healthcare to join our digital health marketplaces and offer their services over the internet. They can also purchase the software for their own practices. But we have recently launched a technology, a full coronavirus management system for states and state governments. And I'm excited to talk to you guys about that and how we can collaborate with Test Utah.
Well, tell us about what you've launched with coronavirus, because I think this is critical. Are you in discussions with the state of Utah? I know that you've been in contact at least today with our team here at Silicon Slopes. But as you know, TestUtah.com being a collaboration with the state and so many other partners, how could we use, and by we I mean the collective we, how could we use this software to help with testing?
So if you'd like, I could actually share my screen and
please do. That'd be awesome.
Okay, hold on 2 seconds.
No, yeah, I'd love to go in depth here and give everyone a sense for the ways that we can work with you on test Utah and give a sense for everything you're working on. So go ahead.
Sure. Okay, can you guys see my screen?
Yeah, we can see it.
Okay, so this is AZOVA.com. AZOVA as I mentioned, is a digital health system. We have been building the technology for about 6 years. We now have thousands of providers and pharmacies who use the technology across the country. We're actually getting close to launching full digital health coronavirus management systems in 2 countries right now for the entire countries. We have launched, if you go to online coronavirus care right here, this shows how we connect the doctors to the hospital triage. So you get a video visit triage with the hospital before you go, to testing locations and pharmacies. And so for example, you go to online provider visit, this will take you, any patient can go anywhere in the nation, can go anytime, day or night, and get a telemedicine visit with a doctor anywhere in the nation. We have launched a similar program with the Utah Medical Association. So I'll show you that right here. The Utah Medical Association has their own marketplace of providers. Any physician in the state can join the network for free. They can set their own price. They can accept insurance if they want to accept insurance. But what we have proposed to the state is a similar program for the actual state. And I actually met with Governor Herbert this weekend and shared this with him. But this essentially would connect all of the doctors in the state, all the hospitals in the state, all the testing locations in the state, and the pharmacies in the state. AZOVA's technology is auto onboard, so any hospital, pharmacy, testing location, or physician can join. So we would propose that we would connect all of the, the parties. So both the UMA, independent physicians, the Intermountain physicians, and the U of U physicians, because this is where we really all need to come together. This is a life and death situation. Where we can all band together and reach patients and help them online and prevent them from going into offices or into the hospital. And then the testing. So this is where we could plug into Test Utah. So you have to have a lab order, right, to get a lab test. So if you have a lab order, you could come here and schedule your test. If you don't have a lab order, you would go to Test Utah. And to schedule your test, each testing location can sign up on the testing location marketplace, and patients can register. This registration collects their insurance. Their payment can also have an additional coronavirus assessment associated with it, and also sends the results to the patient the ordering physician, and the Utah Health Department simultaneously. In addition to that, we are able to deploy what we call patient-reported outcomes surveys to patients. So relative to the time point at which they got the test. So 1 day later, ask them for their symptoms. 4 days later, ask them for their symptoms. A week later, ask them for their symptoms. This data could be used to create a very powerful diagnostic algorithm, predictive algorithm, where we could predict who has the virus without even doing a test, if we have enough participation, and could be tied into the data that is being collected by the Test Utah Qualtrics data as well. And so the hospital segment. So same concept. So the issue with the hospitals is everybody's just going to the hospital because they think they might have COVID, and then they're going and getting COVID when they're at the hospital, right? So the goal is to prevent the vast majority of people going to the hospital and then taking them through a COVID video visit assessment before they go to the hospital. So you register for a video visit with the hospital, with someone at the hospital, and they'll tell you if you qualify to come or not. And if not, then they can triage you out to an appropriate facility. And then this is what it looks like. So when you register for a visit or a test or something like that. And then the pharmacy section is a telemedicine technology for pharmacies as well to coordinate delivery electronically. And so this is what my team and I have been building for the last 6 years. It's very exciting. You know, we are, you know, it's almost as if this is all we were preparing for, you know, because we're ready for this right now.
That's incredible. Dr. Eberting, I have some questions for you because they're the same questions that, you know, we've been getting with testutah.com, and I think they're important. Who would own the data?
Mm-hmm. Yeah, so the patient owns their own data. They have access to the data, and the physician, if the patient establishes a patient-physician relationship with the physician also would retain access to that data, just like he would in an electronic health record system.
But you wouldn't retain the data inside of your software. That would all be, you know, encrypted or anonymized or something like that.
It is encrypted, but it remains in our system. So by HIPAA regulations, we have to retain healthcare data for a minimum of 7 years. That's the law.
Right. So it's HIPAA compliant is the main point.
Yes. Yeah. Our system is HIPAA High Trust SOC 2 certified.
Mm-hmm. So I have another question for you. Testutah.com, all the tests that, you know, are taken or administered at testutah.com locations, they're actually free. There's no insurance, required. How would that, but other testing locations, you know, there is insurance and you know, each one of these are a little bit different. How would that work with this system?
Yeah. So depending on the testing location, they can turn that part on or off.
Okay. Yeah. That makes sense.
Mm-hmm.
And how would you tap into like the various testing locations? You know what I mean? Like as they're ramping up, would you just be getting that data directly from the state?
Yeah, they can. You mean to onboard them onto the marketplace?
Yeah.
Yes, they can actually sign themselves up, or we can register them for them. Okay, so this is a live testing center marketplace right here,
Mm-hmm.
and they can just go and join the marketplace.
That's super interesting.
Right there. So it's fully automated onboarding. They just enter their information, and then boop, it lists them in the marketplace, and they're live and ready to go.
Well, I think this is fascinating. We gotta talk further when we're not being broadcast live on social media. But I really appreciate you showing this, and I promise you will be hearing from our team on the Silicon Slope side, and we'll try to get you know, in with the state as well, because I think this tool is amazing. How is just as a company overall, and you know, you as the leader of this company, how are you holding up? How's the company holding up?
You know, it's almost like, you know, about 2.5 weeks ago, the Red Sea was parted for this technology. All of the barriers to adoption were just wiped away in 1 day. You know, telemedicine, reimbursements, you know, the reimbursement issues were taken away. Physicians are now clamoring for it. You know, we've been slammed with onboarding providers all over the country.
Isn't that amazing? It really is like you were built for this moment.
Yep. Yep, it's been pretty exciting.
I love it. Well, how can obviously the website's right there on the screen, but if for those at the state and other partners with testutah.com and other folks watching who are partners with testutah.com, how should they get in touch with you and the team?
Yeah, so you can reach me. My email is Cheryl Lee at azova.com. CHERYLLEE at azova.com. We'd be happy to talk to you. We also have a lead form on our website that will reach me as well.
Perfect. Thanks, Cheryl. I really appreciate
Yeah,
you coming on. I know we'll be talking more soon as this thing continues.
sounds great. Thanks so
Stay
much.
safe. Thanks so much.
Bye bye.